welcome. I'm glad you decided to join me today. Today we're going to talk about a very fascinating topic, whether there's a link between a caffeinated beverage and what's called long QT syndrome type 1, which is a heart condition. First, let's talk about the sad story of the alleged link between a lemon energy drink and a young woman's death. According to NBCnews.com and Today.com, a legal action was filed alleging that a 21-year-old college student died from drinking a heavily caffeinated lemonade drink at Panera Bread. The suit was filed on behalf of the parents of Sarah Katz, who was a 21-year-old university student. According to Today.com, she had been advised by her physicians to avoid energy drinks, but the drink contained approximately 390 milligrams of caffeine. For your reference, this is about the amount of caffeine in 2 to 4 cups of coffee, depending on the specific brand and how heavily caffeinated it is. On September 10th, 2022, Sarah consumed the lemonade drink, went into cardiac arrest, and sadly died hours later. Sarah had a heart condition called long QT syndrome type 1, which we'll refer to in this video as LQTS1. Sarah had been diagnosed with LQTS1 at 5 years old. This condition greatly increases the risk of dangerous heart arrhythmias, that is, abnormal heart rhythms, which can lead to dizziness, fainting, collapse, or even sudden death. I want to emphasize that any direct link between Sarah's unfortunate death and the lemonade drink is only alleged as of the date this video was posted and has not been held to be legally factual in any court. Let's talk about what long QT syndrome type 1 is. Did you know that your heart has its own electrical system? It's what keeps your heart beating in a regular rhythm, pumping blood throughout your body. But sometimes this electrical system can go haywire. LQTS1 is one of many conditions that can abnormally affect the heart's electrical system. About 1 out of 2,000 people have inherited and congenital, meaning present at birth, long QT syndromes. There are many types of this condition, such as LQT syndrome type 2, LQT syndrome type 3, etc. Some people with long QT syndromes have no symptoms. Some faint, some may have heart palpitations, and some may have cardiac arrest, meaning that the heart no longer effectively pumps blood, which can lead to sudden death. LQTS1 causes an abnormality known as QT prolongation, which means that the heart takes longer than normal to electrically recharge between beats. This prolonged QT interval, which can be measured on an electrocardiogram, can be life-threatening when it leads to a heart rhythm disorder called torsades de pointe, where the heart beats irregularly and can cause fainting, seizures, or even sudden cardiac arrest. Torsades de pointe is a heart rhythm that can spontaneously stop and go back to a normal heart rhythm, but unfortunately, it can also turn into what's called ventricular fibrillation, which is an immediately life-threatening heart rhythm if not treated immediately. There are many things that can induce or aggravate arrhythmias in people with LQTS1, including low electrolytes, things like sodium, potassium, or magnesium in the blood, certain drugs, an underactive thyroid, and abnormalities in heart structure. LQTS1 often goes undiagnosed because its symptoms can mimic other conditions or be mistaken for a fainting spell due to some other cause. The risk of sudden death with LQTS1 and other forms of LQTS is several percent per year in people who have this condition. What can this mean for you or your loved ones? It's important to seek prompt medical attention if you experience lightheadedness, dizziness, near fainting, palpitations, chest discomfort, collapse, loss of consciousness, shortness of breath, or any similar symptoms or episodes. These and other related symptoms can indicate many different potentially serious medical conditions, only one of which is LQTS1. You should also seek medical advice if you have a family history of sudden cardiac death. Genetic testing can confirm the diagnosis of LQTS1, although LQTS1 can be present without abnormal genetic test results. Electrocardiograms, stress testing, and clinical manifestations may lead to a diagnosis without a positive genetic test. Early diagnosis and appropriate management can significantly reduce the risk of life-threatening events with this condition. Treatment options include long-acting beta blocker medications such as the drug called nadolol to help control the heart's electrical activity. Avoiding triggers, such as certain medications or strenuous physical activities, may be necessary to minimize the risk of abnormal heart rhythms or arrhythmias. An implanted cardioverter defibrillator, known as an ICD for short, is indicated in people who have been resuscitated after cardiac arrest and in those who have fainting despite appropriate drug treatment. Thanks for watching this video and taking a closer look at long QT syndrome type 1. I hope you found this information helpful and interesting. As always, check with your own healthcare provider to determine tests and treatments, if any, that may be appropriate for your specific circumstances. Thanks very much for watching and listening, and until the next video, stay healthy.